Good afternoon and welcome to The Surgeons. I'm Dr. Scott Wrye.
I'm Dr. Wesley Hall, and is it still afternoon, or is
It's afternoon, because that's when the show comes on.
it's afternoon somewhere?
It is afternoon somewhere.
That's great. Anyway, thanks for coming. We're very happy to have you here today. We're going to be talking a little bit about liposuction. Liposuction is a surgery that we do that is done very, very frequently in this country and other countries for reduction of fatty tissue.
We're going to be focusing on a patient that I think maybe a lot of the viewers might remember. It's a patient of yours that we've had in studio. We've done a facelift on her. She also has some liposuction. So as typical to the theme of our show, we're going to see her, we're going to talk to her, we're going to see surgery, which I think is the cool part about this show, and then we're going to wrap up by talking about sort of her results and what she went through. So with that in mind, tell me a little bit about this patient briefly. She's a typical liposuction candidate. What's a good patient for liposuction? I don't know. Think that I'm uneducated and need to know something.
Well, I was being educated that we had a theme to the show. I
Yeah.
thought that it was something that I just came in and made stuff up as we went along. Now I know that we have a theme.
Yes.
This is we're very erudite here.
Yes,
on the
we are.
Surgeons.
Yes.
A typical liposuction patient is a patient who is interested in contouring the body. And I know that many people think, hey, I'm going to do liposuction and I'm going to take away everything that's bad. And I'll frequently have a patient that will come in and say, oh, just suck everything out. Just take it all out.
Sure.
This is absolutely the wrong thing when we're considering liposuction. And I think that you would totally agree. Liposuction is not an operation to lose weight.
No, absolutely not. It's an operation in someone who is of ideal body weight. So you need to start out reasonably fit or close to your ideal body weight to take care of fatty deposits are out of proportion to the rest of the body. So it's a sculpting operation, right?
Out of proportion, I think that's exactly the term. I'm going to argue that a patient may not be at their ideal body weight, because many people are never going to be at their ideal body weight. But it is, like you said, an operation of trying to achieve proportion. So even if someone may be a little bit overweight, they still may be a candidate for liposuction. But the idea is we want to bring their body into proportion. And so if there is an area of their body that is out of proportion, it's bigger because of an excess fatty deposit, that's a good candidate for liposuction.
So tell me about your patient. What areas of excess does she have?
So this particular case is patient Laren, who has had other procedures before, but she has noted over the past several years that she feels like there are some areas on her flanks and above her backside that are just bigger than the rest of her body.
Sure.
And so when we're examining a patient, you need to examine these areas and see a patient. I also want to make clear that this is not a procedure where skin is going to be removed, or there is going to be a significant tightening of the skin beyond which the body's normal elasticity is going to accomplish.
Well, I think that's an important differentiating statement when you want to talk about, for example, a tummy tuck, right? A lot of times a patient will come in, they've had a child or two, and their complaints are related to their abdomen. They might have a little bit of lipodystrophy, that's extra fat, right? But really their problem is loose skin and laxity of the abdominal wall musculature. And those are conditions that are treated primarily and best with a tummy tuck.
Not going to be treated with liposuction.
Not going to be treated with liposuction. Liposuction sometimes is an adjunct and you perform it at the same time, but they're a tummy tuck candidate. So it's very important to go see a qualified doctor so they can examine you and determine what the appropriate procedure is.
So in this particular case, Laren's main concern is around her flanks, her back. She does have a concern about her abdomen as well, but she, in her situation, I think is a good candidate for liposuction, making very, very clear that we are not going to be removing skin. We are only removing fatty tissue, and that is exactly what liposuction does. It is a procedure where fat cells are removed.
So we're getting the wrap-up sign, but let me ask you this real quick. You remove those fat cells, they come back?
Well, I was going to try to think of a smart aleck answer, but I can't right now because we're getting the wrap-up sign. Fat cells are just like any other cell in the body. Once we've removed it, it's gone. It isn't coming back, and that's why liposuction makes for such good contouring, because those fat cells are never to come back. Now, there are other fatty cells in the body that are certainly going to grow if you gain weight, but the idea is, once again, it's proportion. Now, if I've gained weight, it's going to be proportion. If I lose weight, it's going to be proportion. And that's what we're really trying to achieve here.
Well, thank you for clarifying that. We got an exciting show coming up. We'll see you after the commercial break. Welcome back to The Surgeons. Today we have Lauren with us. She's got a personal story that she'd like to share with us.
I've gained a little weight, and because I'm nearly 70, I'm not really going to go into any kind of big diet for the rest of my life. I'm pretty much through with that. But I do have some lumps and bumps that I'd like to have taken off me.
I'm almost 50. I've got lumps and bumps too.
Well,
you're not alone.
You don't have 2 5-pound loaves of bread on your butt.
Mine are 4.
Well, mine are following me 10 minutes into the room after I arrive. So I have never had a butt in my life, and I just as soon have it gone.
So what are we going to do with these loaves of bread?
I believe we're going to have liposuction, and we're going to take them out. Now, Dr. Hall told me that I wouldn't have Christy Brinkley's butt, and I'm okay with that. Let me just say one more time, I'm going to be 70. I'm sure it's going to be age appropriate.
Well, you know, that brings up something interesting. A lot of patients ask me, hey, Dr. Wrye, I'm 70. Am I too old for surgery? And really, there's not a chronological age that we adhere to. It's really, how healthy are you? I mean, you've obviously done well with surgery 5 years ago. I anticipate, obviously, you'll do very well with this one. Did you feel like you had trouble because of your age at all?
No, and I did ask Dr. Hall, was I okay at 70?
But Dr. Hall doesn't know what he's talking about.
But he made me feel so much better.
Well, I do think that a lot of it, when we're talking about age, physiologic age is certainly what we're important when we're dealing with surgery. How you feel, though, is another thing. And as you had said, I just felt like I'm younger than I'm looking right now.
I felt unhappy I didn't look the way I felt inside.
Well, I think that you are a great person. I know all the good works that you do, not only in your business, which I think is the greatest work that you can do, is having a successful business, but also in some of the humanitarian stuff that I know you're involved with as well. We're so happy to have you here. We're glad we're going to be doing this. We're going to be moving on, showing surgery at a later time, and we're going to wrap this up, I guess.
Yeah, and I want to thank you for coming on and sharing your story. And I think we've got a lot to look forward to, seeing her surgery, seeing her post-operative results, not just her delayed results months later, but within a week. We're going to see a lot of fun stuff.
So we're talking about liposuction here, and we've got Lauren, who we have done other surgeries on as well, but she's also having some liposuction. Her biggest concerns were around the flanks and around the back areas, which are common concerns for many people, and she also had a concern about her tummy. And so that's what we're going to be doing on this area, is we're going to just be doing some liposuction of those areas that are concerning to her. To prepare somebody for liposuction is no different than we would for any other operation. Certainly there are areas when we're dealing with liposuction that may be smaller, that might not even require a general anesthetic. But when we're dealing with an area that might be a little bit larger, or certainly if the patient has no interest in being awake, which I can certainly understand, then we're going to talk about a general anesthetic. And the preparation for a general anesthetic is no different than it would be really for any other cosmetic surgery, or most other surgeries for that matter. So the patient is coming into the surgery center, will be met by the staff, all the questions answered in terms of health and the appropriateness of the operation. An IV is usually started, and then the anesthesiologist will of course meet with the patient and discuss what's going to happen as well. So for liposuction, the idea is we want to try to remove fat. We're trying to remove fat in a manner that leaves us with as little scarring as possible. But the idea behind liposuction is we're going to make a very, very small incision, and we're going to introduce a cannula. A cannula is like a big tube with a hole on the end of it that can actually pass in and out through the fatty tissue, through the fat cells, break them up, disrupt them, and then apply suction to them, just like with a vacuum cleaner, and suck the fat out. So we break up the fatty cells inside the body through a very, very small incision, and then they're aspirated or sucked out into a suction device. The key here is to make sure that the amount of fat that we're removing is commensurate with the surrounding tissue. We want to have good proportion. We don't just want to suck fat out indiscriminately. It needs to be done in a manner that gives us the best contour and the best overall, what we'd say, sculpting of the area. Every patient's liposuction is going to be different. There are going to be some patients who have larger amounts of fatty deposits in certain areas of their body than other patients. So for a situation like we're doing today, the areas that are most concerning are going to be around the back and just above the buttock region, and also in the abdomen. And I'm estimating that we're going to probably take out about 3 liters, somewhere around that area. And people say, well, what's a liter? Well, if you think about a 2-liter bottle of Coca-Cola or Pepsi-Cola, a 2-liter bottle is something that you could divide in half and get a liter, a little more than a quart. So when you're thinking about how much fatty tissue there is to be removed from a certain area, we're thinking about it in terms of milliliters or cubic centimeters, which then translates into a liter when we're talking about 1,000 of those. And so everybody's got different amounts that might need to be removed, but as the surgeon, we need to be able to estimate kind of what we're thinking we're going to remove, so that when we're actually in the operating room, we can say, hey, I've taken out about this much. That's about where I think I want to be. Incisions that are made need to only be as large as they need to be to admit the cannula. The largest cannula that we'll usually use is a 6 millimeter cannula. So if you think about a centimeter being, well, just under half an inch, a 6 millimeter cannula is not a very big incision. It's that big. And usually when we're doing liposuction, we're not going to have an incision that's any larger than that. Every area that we're operating on may require 1 or 2 incisions. So if you're a patient who's having 3 different areas of liposuction, well, it might mean 4 or 5 incisions potentially to get to all those different areas. It may only require 1 incision depending on the area and how much fatty tissue there is to be removed, so on and so forth. But all of the liposuction is done through those small incisions. Once the fat has been aspirated or removed, then the incision is closed with, again, a small dissolving stitch. The incision can be left open, but I prefer to close the incisions with a small dissolving stitch. When a patient is having liposuction, the fatty tissue has been removed. Now there's a defect. There's nothing there where there used to be something. And the body wants to fill that area up with fluid. Anytime there's any injury to the body, there's going to be swelling, and that fluid will collect in an area where there used to be fat. So if somebody has had a liposuction procedure, there's very likely to be some swelling in the area, and we usually will have the patients wearing some compression garments. This could be as simple as a wrap that goes around, say, the abdomen. It could also be a form-fitting garment like a girdle, or if there's liposuction done in the chest or the arms or something where there's a garment that may fit over that area, then we might employ such a garment as well. We usually will keep that compression on for a number of weeks. This varies in terms of the patient, how much we might have removed, and the surgeon's preference. I usually like to keep a compression garment on for at least a couple of weeks afterwards when somebody's having liposuction. In some cases, it may be longer.
Hey there, everybody. Welcome back to Surgeons.
We survived the operating room.
Well, more importantly, the patient survived.
Yes, that's usually the most important.
Yes. And Joe, all kidding aside, that always happens, right? I mean, modern surgery, liposuction, and really any of the things we do, very safe, very effective, right? So, I mean, we joke a little bit about the safety, but I really don't want to joke about that because it's a very safe procedure. So let's talk a little bit about what we saw, what the viewers saw, which was a patient that had liposuction. I think she had a very successful operation. We got to see a little bit of the surgery. Maybe you can tell me about the specifics, how you do the surgery, what the recovery is like with regards to pain, discomfort. Are there any post-operative limitations that she might have had that you told her about?
So what we do is, obviously, the number one thing is getting the patient properly prepared and making sure that we know where we're doing the liposuction. These were some of the drawings that we see.
Gotcha.
And I know that you and me and most anybody else who's doing this competently is going to mark the areas preoperatively.
Sure.
I always like to mark my patients usually in the standing position and then see how they go when the patient's lying down, because when they're lying down, it's completely different than when they're
the
standing.
fat redistributes and you've got to maybe focus on a different area that might be marked. So.
Exactly. So that's why you've got to say, my markings in the preoperative holding area are done appropriately in the standing position.
Sure.
Then we take the patient back to the operating room. We're going to make small incisions to introduce the cannula, as the viewers have seen. And the fatty tissue is then broken up by the liposuction equipment, and then there's aspiration or sucking out of the fat cells. Those fatty cells, as we had talked about earlier, they're gone. Once they're gone, they're never coming back.
Sure.
Look at this. Oh my goodness. It's unbelievable. It's bruised, but it's fine. Those 2 5-pound loaves of bread that were sitting on the top of my butt, they are gone, gone, gone. And I mean gone, like magically, unbelievably gone. I've taken pictures and showed them to everybody. They can't believe it.
Now listen, I don't mean to say
Yes.
this happens with everybody, but one of the things that you told me before we went into surgery, you said, listen, I don't exercise, I don't want to exercise, I have no interest, we're not doing this. And right after surgery,
Yeah,
you
I
told
felt
me,
like exercising.
felt like exercising.
And dieting, both. It was
Why?
because it was inspiring to see what you could be. It wasn't a case of dieting and then having these other imperfections that I made myself go away. The fact of the matter is, I feel great about how I look now, and so 30 pounds would make me feel even better. That's the truth of the matter. It's actually given me reason to consider a lifestyle change, which I hadn't considered before. So looking at the way my body looks after this liposuction, which is remarkable, Two things have happened. Number one, I'm actually going to go ahead and in my 70th year, let me just say that one more time, I'm going to go ahead and look at losing seriously 20, 30, maybe even 40 pounds. Then I'll be able to come back to you and say, okay, here are the results and here's some imperfections that I'd like to have taken care of. I didn't see that coming before I had the liposuction. I sort of had resolved myself to the way that I physically was going to look. Yes, adorable. However, there are improvements that I can still make and feel excited about making now. This particular amount of liposuction that I just did was critical for me because I'm 70 now. At 65, it wasn't the same. At 70, I'm so much happier with myself. I mean, this is amazing to me because I can now consider other surgeries. I'm a lucky girl. I can afford to go see a wonderful, wonderful surgeon like Dr. Hall, and I can make something happen for myself. It hadn't occurred to me all those years that I was working that I could do something for me. So this is like my gift to myself in my 70s is how many things can I do to make myself look better, but make no mistake, I always want to look like me. So, and I think he accomplished that. I don't know, if you look like you're this happy, I think everybody around you feels that you're this happy. I couldn't be happier.
I'm going to tell most patients they're going to be back to normal activities after this operation within days.
Normal activities meaning able to go back to work, able to take care of your kids,
you're going to be
drive your kids to school,
shower,
things like that.
Go to the store, do exercising even.
Right.
I will generally have my patients wear a compression garment for at least a couple of weeks afterwards. I know some patients, some surgeons will say they want their patients to wear it longer. I think it's dependent upon the patient, how much liposuction we're doing. I mean, this is a topic that can go on and on, but I think the important take-home message is relatively painless.
Mm-hmm. I would call it more sore than pain, right?
You're sore afterwards,
Yeah.
no question about it. But when you think, I'm having major surgery, it's not like this is going to be something that hurts a lot. Kind of like a facelift.
Sure.
I think we saw a facelift a couple weeks ago or last week. I tell patients they're not going to have pain with this that lasts more than a day or so.
Patient might take one pain pill.
One pain pill,
Yeah.
frequent.
Yeah.
Liposuction, very, very safe, very effective, not going to tighten the skin tremendously.
Sure. Well, and that's an important point. You've got to rely on the patient's abilities or ability of their own skin to tighten up themselves, right?
All right. Hey, listen, I think we're getting the wrap it up sign here. This has been good stuff. We were told that you talk too much.
That's never the case. I've never been told that once in my life. That's funny.
At any rate, we're very happy that y'all came. Thanks for putting up with Dr. Wrye in your house and your living room. And thanks for putting up with me. We'll hope to see you back soon.
Thank you. See you next week on The Surgeons.